Dr. Wilder, tell us a little bit about your practice in Scottsdale, Arizona.
That's right. I have a very innovative family medical practice in Scottsdale that we started 4 years ago, and our goal is inspire health and to be the antidote to hit and run medicine that's become the norm.
Well, I have seen your clinic, and it is not the norm. It is definitely a cut above. Many innovations have been incorporated into your place, the colors, the water. I don't think there's a straight wall in your place, is there?
Hardly. It's a wonderful. We had a wonderful designer, Jane Malkin, who's out of San Diego, and she understood our vision, which was, healthcare through the entire landscape of people's lives, and brought this River of Life theme through the clinic. And it's a true healing environment, which is as important to the providers and the staff as it is to the patient.
Well, you were here at the event and you talked about innovation in healthcare, and you said some very interesting things about innovation. And one of the things is that you had an opinion about the healthcare values and how they have been declining. And what I'd like you to do is, can you share with us how a physician in practice can help reverse this decline?
I think medicine went downhill when it became so focused on disease and lost its focus on health, when we became so focused on rewarding visits and not value. What are the true health outcomes? And then became prescription machines, and I like to say prostitutes of the pharmaceutical industry. We can stop that and move back from that when we look at what is truly life transforming to our patients. How do we get creative financially and away from the price fixed insurance industry, and be able to take time with patients, to truly listen to them, to help them change their behaviors, because after all, it is their bodies. They own it.
Mm-hmm. You've defined that healthcare values begins with the patient. Now, how is a physician going to help a patient get engaged in changing this value? I mean, the patients are so used to having, a reward for going to the doctor. How do we help them get involved with this?
I think it's very simple to engage patients. And when I taught, the first half of my career was in academic medicine, and residents would get so frustrated when patients would not follow their health advice and quit smoking or lose weight or do these kinds of things. And I personally don't look at my goal as changing health behavior. My goal is to inspire people to think about their health differently any way I can. I have hundreds of tactics that I use that might help people. It might be to be the drill sergeant type of thing. It might be, look, with this array of things, you're looking at a 13-year shorter life expectancy and a 300-fold increased risk of disability. What are people's fears? They are more afraid of losing their hair than losing their life. They are more afraid of disability than death. Use those fears.
Wow. What a concept.
It's true.
And another concept that you introduced was home health concept. Could you be a little more specific in what this really means?
Well, we know from very good data that patients who have a medical home or a defined place where they get their primary health care, and that medical home is focused on prevention, is comprehensive in its scope, and coordinates care across this very complex system, that those patients have improved outcomes, improved morbidity and mortality, improved preventive care provision, improved patient satisfaction at a much lower cost. So this concept is catching fire with companies like IBM that are doing a pilot. United Healthcare is doing a pilot. McKesson has proven with the Medicaid program in Texas that the medical home concept is a huge boon to wellness and to lowering cost.
Now, we know that you have a lot to do periodically with the Mayo Clinic.
Yes.
And tell us, in your opinion, is the Mayo Clinic leading the way? Are they charging forward with this? Or are they a little more of the old model and they're a little slow to change?
The Mayo Clinic is a wonderful organization with a lot of amazing physicians and people involved in it. But one of the things that I found is it is very disease focused in the mindset. And, what I say to Mayo is your mantra is the best interest of the patient is the only interest to be considered, as Charles Mayo so well stated. What I bring back is you cannot attend to the best interest of the patient in 1,000 pieces. You need to have one place, one doctor who's that quarterback for that patient, one place where their whole health is being attended to and not an organ system or a disease process. Then they will lead the way.
Very good advice. And speaking about advice, what would you say to a physician who wants to develop a wellness program in their practice? And where do they start?
Well, we fell into wellness a little bit by accident, but it's because of our passion with what we do. We are passionate about prevention and about inspiring health, and here's corporate America saying we're fed up, we're not getting a value for our dollar in standard health care, so we need a different way to do this. So this opportunity is just there for the taking. But I think physicians need to take, or anyone interested in wellness needs to take a very thoughtful approach. They need to look at what are your strengths? What are you really good at? What are you passionate about? Where does your passion and your strengths intersect? Where are your weaknesses, and maybe what kind of affiliations could you make, or hiring, or what have you, to compensate for those weaknesses? Design your product and be very thoughtful about who your target market is. You don't want to do all things for all people. You won't be good at it.
So there are physicians that will hear about this conference. They didn't attend. They wanted to attend. What would you tell that physician that's thinking about maybe attending next year? What would your advice be to them?
I would say do not miss this for all the world. The information is exceptional. The contacts that you make at this meeting are worth their weight in gold.
Thank you.
And Immunolab's a wonderful company.
Oh, thank you. Thank you.